Good afternoon, everyone, and good afternoon, Doc. We are Group 6 of 1D, and we are here to present to you our Project A.K.A.P, or Agarang Kalinga at Alagang Pinoy program. Our vision, our program envisions all Filipinos free from hunger and poverty, have equal access to opportunities, and to create vital, healthy lives for their families and communities now and for the future. Our mission, on the other hand, to give opportunities among the economically active poor by providing opportunities to contribute to poverty alleviation and to promote the rights and welfare to Project A.K.A.P and project services implemented through the coordination with other interagency and with the local government office. Here are the proposed programs in affiliation with different interagency. Starting off with the Department of Health. Our objective is to ensure and improve the healthcare services of the community. Program components include expanded maternal child care, expanded program and vaccination, free prescription drug assistance program, breast milk or milk bank, regular checkups, and visiting of barangay health workers. Expanded maternal child care. The Maternal and Child Health Program aims to support pregnant women to experience healthy pregnancies and to support parents of their infants and young children and their families in helping children to develop optimally into adulthood. This is to provide support to improve the health and well-being of pregnant women, new mothers, and babies facing challenging life circumstances. Through this program, the Maternal and Child Health Section funds 10 community health centers and one health agency to provide health care services to children in their community. Services are targeted to low-income, uninsured, or underinsured children. Care is provided through office visits and home visits, and, and is free or available by a sliding fee scale, depending on the child or the family's financial situation. Other services include physical exams, health screenings, immunization, social services, providing information on topics such as child's growth, development, and safety, social services, and helping parents with coordinating care and getting other needed services. Secondly, expanded program on vaccination. Vaccination has been oftentimes neglected in some rural areas, which is why this program also includes the estimation of vaccine coverage in that area and with close monitoring of incidence and mortality to diseases that can be prevented in the first place, like polio, tetanus toxoid for pregnant women, pulmonary tuberculosis in children, and, in the case of Rosario, measles infection. We can implement this program through routine surveillance and immunization for children and mothers included to prevent further complications. Thirdly, pre-prescription drug assistance program, a group sponsored by drug companies, doctors, patient advocacy organizations, and civic groups. It helps low-income, uninsured patients get free or low-cost brand name medications. Breast milk or milk bank. Human Milk Bank's campaign drive provide safe breast milk to infants in emergency situations, such as those who are affected by disasters, are critically ill, or born prematurely. Breast milk provides all the nourishment that infant needs in their first 6 months of life. It's critical that newborns must be exclusively breastfed to give them a healthy start in life. Regular checkups and visiting of barangay healthcare workers or BHW. Barangay health worker is a person who has undergone training programs under any accredited government and non-government organization and who renders primary health care services in the community after having been accredited to function as such by the local health board in accordance with the guidelines promulgated by the DOH. Functions include to monitor and assess maternal child care, to give reports on the child status and progress, and to make health and wellness of the community together with the barangay officials. Community-based care is an important component of providing a continuum of care for low-resource communities. The health and well-being of women, newborns, and children are inherently linked. When mothers are malnourished, ill, or receive insufficient care, their newborns are increased risk of disease and premature death.
Department of Social Welfare and Development. Objective to preserve and strengthen the family as a unit and to develop caring interpersonal relationship. Program components, Pantawid Tulong Program, Trabaho para sa Panlipunan Program. Pantawid Tulong Program is a conditional cash transfer program that aims to eradicate poverty by investing in health and education in ages 0 to 18 years old. This program primarily focuses by investing capability building so that they will be able to break poverty cycle and providing cash assistance to address the short-term financial need. Social worker and barangay officials will identify and assess family who will avail the program and explain the return service. Social assistance giving monetary support to extremely poor families to respond to their immediate needs such as food and daily basic expenses. Social development, breaking integrational poverty cycle by investing in health and education of poor children programs such as health checkups for the family, especially pregnant women and children ages 0 to 5 years old, vaccination and deworming of school children ages 6 to 14 years old, enrollment of children in daycare, elementary and secondary through their college or vocational studies, family development session and interaction and projects. Trabaho para sa Panlipunan Program in coordination with the local mayor to assess the needs for social work practice in the community to focus on those who are really vulnerable, oppressed, and are living in poverty. This program concerns itself to improve the ones in need to have a knowledge and try to have efforts to meet with the basic needs, enhance their social functioning, and their self-determination to their community. TESDA can give trainings, information, education, and certification to individuals. Department of the Interior and Local Government. Objective to build up the trust of the community by ensuring the safety and security of each individual. Program component, Relocation Action Program, RAP, Balik Probinsya Program, Job Order Works. Relocation Action Program. The program is to intend to address security of tenure and infrastructure requirements of the informal settlements on government-owned lands proclaimed or designated as socialized housing site designated by the local engineering department. It covers survey and titling of individual lots for disposition to qualified occupants, infrastructure and development, housing construction and rehabilitation of existing project site. Local engineering department will assure the accessibility of the location to the hospital, to school, to market, and to individual working places. The Balik Probinsya Program. This program encourages people, especially informal settlers, to return to their home provinces, and the government agencies will assist them in this transition with the support and incentives such as transportation, family, livelihood, housing and education, The Department of Trade and Industries will assure the increase in job opportunities, and this will encourage more people to return to provinces. The provincial program will aim to boost countryside developments, especially agricultural development, and it will focus on addressing the problem with the congestion in the urban areas. Job order works. Different agencies will teach the returning residents so that they will gain knowledge, especially on farming, because of the large agricultural lands that we can develop. Province provide livelihood training program to expand their skills for the job that we're able in the province. The government will encourage the business owners to expand their businesses or companies in the province to generate more jobs. Relocate residents will undergo entrepreneurship training, or the government will help residents to open or start small businesses through the sponsorship of TESDA and DOLE.